If we look at the United States, the #1 cause of death in this country is going to be sudden cardiac death. And ventricular tachycardia is a form of sudden cardiac death, so it's quite common.
Mr. Garcia has been a patient of mine for decades. Unfortunately, Mr. Garcia, through his many years of cardiovascular disease, had damaged his heart muscle, and it was leading to rhythm disturbances that were both life-threatening and causing a lot of problems.
You had the arrhythmia that was coming frequently, and that it was very difficult to live with it.
Mr. Garcia's specific circumstances of a damaged heart muscle, but having gone through revascularization and valve surgeries, but this persistent arrhythmias, these electrical abnormalities, which were not only impacting his length of life risk, but really affecting his quality of life, made him a perfect candidate for an innovative and revolutionary procedure.
So this procedure or treatment option is very rarely used, even across the entire world. It's for patients who have really exhausted every other treatment alternative, and these patients have to be evaluated in a multidisciplinary setting and have to be treated in departments that can develop synergy between cardiology and radiation oncology, which are two teams that typically do not interact.
What the radioablation is doing is targeting those areas of abnormal heart tissue in order to prevent that circuit and prevent that arrhythmia from happening again. So it's essentially delivering radiation therapy to sick portions of the heart to not allow it to conduct electricity and cause dangerous arrhythmias.
When the doctors explained to me what they were going to do, I still had apprehension because you were the first one that was going to be done here. Once they were ready to go and they mark in my body the areas that they were sensitive and they were going to handle, I don't think we spent 30 minutes in the process. 30 minutes.
So far, we have been very happy with this patient's progress. He has not had any alerts that have caused from any arrhythmias. His ejection fraction, measure of his heart function, has actually improved after his treatment. He feels well from his standpoint with regards to his energy, performance status, and so we've been very happy so far with his progress.
Once I left, I couldn't believe you have, I said, it's impossible. This is a miracle. And it is.
This procedure is extremely revolutionary, both in terms of the intersection between a technology that's generally in an oncology world and then the cardiovascular expertise. And bringing those two disciplines together through a technology which allows for a better patient outcome with less invasiveness, less recuperation, if not no recuperation, is where we want to go. We want to take the best of everyone's intellectual capital, the best minds we have, and put them together to come up with new ways of approaching diseases that previously we did not have options for the patients. And I think that's what we provide at the Miami Cardiac and Vascular Institute and the Miami Cancer Institute as an example of working together.
I was driven in a wheelchair to the procedure, okay? My wife was with me and everybody in. And to be honest with you, when I finished the procedure, I was the one pushing the wheelchair for my wife, and I drove out. So that's made me the confidence that I needed.